going to talk about some endodontic recalls and some interesting cases. As far as variables affecting endodontic recalls, they tend to differ in populations, different locations, and different offices. Usually, they're about between 30 to 70% of people come back for a one-year recall. Also, female to male ratio is a little bit more on female. Females usually tend to be a little bit more careful about their body and health, and so they come in a little more often. Age group is also a little important. They tend to be a little higher in elderly population. As far as healing, we all know that elderly take a little longer to heal. A lot of studies have shown that it takes up to 2 years for really telling that a case is failing. Methods of evaluation is histology. You can always take a biopsy, send it to the lab. Basically, you can do a lot of clinical evaluation on teeth that come back. For recalls, usually you do a lot of percussion, palpation sensitivity, mobility. If the tooth is mobile, you usually check it. Sinus tract, if there's a sinus tract, that means it's not healing. Periodontal disease is another way of checking it, because it could be endoperial lesion, or it could just all of a sudden have some generalized periodontal problems. Swelling is another case, failing. Other symptoms like just tooth function. Some patients come in and say, this side just feels uncomfortable. I can chew on it, I can bite on it, but it just feels uncomfortable. And there's some cases out there like that. Some patients come in and say, if I press it, a certain direction, and I feel different. And is that really a fail case, or is that success? And as far as factors influencing the radiographic interpretation is angulation, and different ways of taking an X-ray. You could take a mesial angle, you could take a distal angle, and you could see different things. As far as quality of radiograph, I've had digital in my office since '99, and I love it. It's quick, fast, and it's less radiation, 80% less radiation. Proximity of anatomical landmarks is where you could have two separate objects overlap. So I'm going to show you a case on that too. Over time, different studies that came out to say, if a case did succeed or a case failed, they throw in a few endodontists together in the table, 4 or 5 guys, and every one of them looked at an X-ray, and they passed it on to the next one and the next one. And one of them said, healed, another one said healing, and so, every one of them could say something different. It's so difficult to really say the degree of healing. Healing method is also time. 70% of lesions take up to a year to heal. I remember back in school, I was taught to wait at least 2 years to make sure if the case is healing or not. And scar tissue healing is actually a healing, but I'm going to show you a case on that too, and it's really different, but it's healing. This is a case that tooth number 18 is kind of sandwiched between wisdom tooth and number 19 here. She's having some irritable pulpitis sensitivity on number 18 after testing it. You can't really tell where that apex is on that mesial root of 18, and plus, the wisdom tooth is coming in really strong. So that's a case that I recommend definitely using an apex locator. You can kind of tell where, the apex is pretty much right here, but it's always good to double check your work. Actually, I think this case, I thought I had 4 roots when I started it, and then ended up joining together, so it were 3 roots. As soon as we finished the case, and you can see the apex on number 19 is a little bit higher, and this is a 1-year recall. So it's working good, but the wisdom tooth is still there, so it could cause some problems. When I said time is an issue on healing, especially with younger patients, this is one case that came in. Tooth number 30 had some, I think it was a pulp exposure on this one. A lot of radiolucency. I think she was probably about 15, 16, younger patient, teenager. So I took a bite wing, see exactly how much bone we have, but there's a lot of bone loss in differentiation. So we did the case. And this is actually a 6 months recall. So you can tell how much bone we got back as far as healing. So On younger patients, we have great success. They're good healers, and it works great. So this is 6 months.